Hello, and welcome to the Dance Physio Podcast, a podcast designed to explore ideas and foster discussion around dancer health and wellness. We're here to challenge the status quo, bridge the gap between dance science and the studio, and help change the landscape of the dance industry for the better. I'm your host, Erika Mayall, a dancer turned physiotherapist who is deeply passionate about leaving the dance world better than I found it. I'm so glad you're here. Let's get started. Hello, everyone, and welcome back to another episode of the Dance Physio Podcast. I am your host, Erika Mayall. Before we dive into today's podcast episode, just a reminder to like, share, comment, subscribe, do all of the things to help other people in the dance community find this podcast as well. All right, on to today's episode. We are specifically going to be talking about Achilles tendinopathy. I have done a podcast episode in the past just about tendinitis in general in dancers, and I purposely termed it tendinitis, but if you have listened to that podcast episode, you know that I go into depth talking about the difference between a tendinitis and a tendinopathy and why there is different vocabulary and what is probably more factually correct. So we're going to use the word tendinopathy today, but you will have probably very frequently heard this termed Achilles tendinitis before. So if you have not listened to the podcast episode all about tendinitis or tendinopathy in dancers, that is episode 50. I am going to link it in the show notes, and I do suggest you go back and listen to that podcast episode either before listening to this one or even maybe when you finish listening to this one, just because, like I said, I talk really specifically about what is actually happening in the tendon and to the tendon health when we're talking about like a tendinitis versus a tendinopathy. In today's podcast episode, I want to talk more specifically about the Achilles tendon. So that one, a little bit more general, really applicable to all tendons in the body. And then today we're going to dive more into the Achilles tendon. And there are a few reasons why I wanted to do this podcast episode now. When I did the one back in episode 50 about tendinitis in dancers, I fully planned to then cover specific tendinopathies in individual episodes. And I think I even talked about that or mentioned it in that episode, that I would go in and talk about specific ones more in depth. And now is that time for the Achilles. And the reason for that is that we, in most parts of the world, but certainly in North America, are just entering into a new dance season. Dancers have either just been back in the studio for a week or two, or maybe are just heading back into the studio like this coming week or maybe next week. Anyway, we are at the start of a new season, and this is the time of year when we see a really big spike in Achilles issues, and specifically in Achilles tendinopathy. So we're going to talk a little bit about why that is today, and then specifically talk about what exactly an Achilles tendinopathy is and how we can identify them and how we can address and treat them or manage them as well. So we need to understand a little bit of basic anatomy. And again, this is a bit of a repeat if you've listened to episode 50, but it's always good to repeat things. So a little bit of basic anatomy about what a tendon is. So a tendon is a type of fibrous connective tissue that attaches a muscle to a bone. So we have tendons all over our body, and tendons are the connection point between the muscle and the bone. So in the case of the Achilles tendon, it attaches the calf muscle, and it actually attaches multiple calf muscles. So we have something that's called the triceps surae, and that's the junction, we'll call it, of the gastroc muscle. So your gastrocnemius, your big calf muscle. It's the junction of the two heads of the gastroc muscle with the soleus muscle. And the soleus muscle is the muscle that's underneath your gastroc muscle. It's also quite a big calf muscle. It's a really important muscle. Those join together, and then that sort of junction blends into this fibrous connective tissue that then connects those calf muscles to the back of our heel bone, so specifically the back of the calcaneus. So again, the Achilles tendon connects the calf muscles, the gastrocs and the soleus, to the back of our heel. The Achilles tendon is cool because it is the thickest and strongest tendon in our body. And if you are into any sort of mythology or anything like that, you've maybe heard the story of like where the Achilles tendon got its name from. And I'm not going to go in and like sort of tell you that whole story right now, but there is mythology surrounding how it got its name from the god Achilles. And anyway, if you're interested in that, go check that out if you don't know the story. But it is the thickest and strongest tendon in the body. The function of tendons in general, but specifically the Achilles tendon, is to transmit force from the calf muscle to the ankle joint, and it produces plantar flexion movement. So that's pointing our ankle, basically. So in dance terminology, when we point our ankle, that movement is created by the transmission of force from the calf muscle to the ankle joint, being transmitted through the Achilles tendon. And it also works in controlling, or sort of sometimes we term it like shock absorbing, dorsiflexion at the ankle. So as our ankle flexes up, our tendons work in load absorption or load like dissipation or force dissipation. And so in the case of the Achilles, it's when we go into that dorsiflexion. So this would be like going into, say, like a plie or landing from a jump. The Achilles is working to control that dorsiflexion movement. So it's producing plantar flexion movement, pointing our foot, and it is controlling dorsiflexion, which is shock absorption, landing from a jump, landing in a plie, things like that. There are a couple of key differences just that I want to point out. And again, I've talked about this before on the podcast, but a few key differences between muscles and tendons. And these are important to know and recognize, because when we start to talk about how it is we're going to address a tendon issue, we need to know these differences. So the biggest difference, and probably the most important when it comes to rehabilitation or treatment of tendon issues, is that tendons are much slower to adapt to changes in loading or changes in training programs and things like that than muscles are. Muscles are faster to adapt. Tendons take longer. They are slower to adapt. And so this is one of the biggest reasons why I always harp on the need for dancers to have a preseason and to gradually introduce loading and, increase training loads into their season, is because our tendons take longer to adapt. And so we can't expect them to all of a sudden be able to function at 100% capacity when they haven't had a chance to adapt to those changes. So that's one really big difference between muscles and tendons. Tendons are slower to adapt. They have less blood supply than muscles do as well. And this is one of the reasons why treatment of tendon issues, and specifically tendinopathies, can be tricky, because the blood supply is a little bit more limited and just a little bit different than it is for a muscle belly or like a muscle itself. And then, like I sort of said, when they're slower to adapt, they respond to loading differently. So muscles respond to loads in a certain way, and tendons respond to load differently. So part of that is that they're slower to adapt. But when we want to talk about how we're going to train tendons, or when we actually look at kind of rehab and things like that, we generally want to consider lower intensity, kind of isometric type loading of tendons versus more dynamic type movements and things like that. So I'm going to talk more about that when we get into like treatment and what we consider from a rehabilitation perspective. But I just wanted to point out that there are some key differences between muscles and tendons. And when we are thinking about how we're training our dancers, and specifically thinking about pre-seasons and the start of a new dance season, we often are structuring those programs or thinking about our training programs from the perspective of muscles. And we may want to really consider changing that approach perhaps, so that we are taking into account the tendons and the fact that they are slightly slower adapting to things and require a little bit more of a gradual ramp up in loading. So why do Achilles issues, tendinopathies, flare so often early in the season. So like I said, one of the reasons I wanted to do this podcast episode now is because we see a really big spike in people coming into the clinic with Achilles issues in the first few weeks of the season. And it's not usually the first week. I always sort of joke that the first 2 weeks of September, the clinic is relatively quiet, especially compared to the rest of the year. And then week 3 hits, and between week 3 and week 6 of a new season, the schedule is crazy. We're getting loads of phone calls, emails, people being like, I need an emergency appointment. Can you squeeze me in anywhere in the schedule? And it is partly because we see this increase in people having issues with tendons in particular. And it's not just the Achilles, but the Achilles is the most common one that we see with the dance population that we treat. And so why is that? Well, biggest reason is that generally there is a sudden spike in training load right at the beginning of the season. A lot of our dancers haven't danced very much over the course of the summer, which is a good thing. Like, if you've been listening to the podcast for any length of time, you know that I am a huge advocate for having an off season. But if we are having a proper off season, then we also need to have a proper preseason. And the reason for that is so that we can slowly, gradually increase the training load. But in reality, what happens is we have dancers who have had a lot of the summer off, haven't danced very much, have maybe done a week-long intensive here or there, but other than that have had sort of a big period of time off. They come back in and there's this sudden spike in load. They're all of a sudden increasing to 10, 15, 20 hours a week, whatever it is. So that's one of the reasons why we see a really big kind of spike in Achilles tendinopathy early in the season. Another reason is that we have a really big increase in jump volume or impact landing volume. So even if we have dancers who have been like relatively active in their off season, and maybe they've been following an off season training plan, and if you have followed any of the information about periodization, generally, that off-season time is a time to really focus on foundational base levels of strength and conditioning. So we might have dancers who have actually been fairly active and maybe really focusing on strength and conditioning in their off-season, which is awesome, but they probably have not been doing as much impact or jump landings as they do in dance. We know that dance is really intensive in terms of impact landings, and we've again talked about this before on the podcast, but we can see upwards of 200 jump landings in a single 1.5 hour ballet class, and that would not be uncommon at all. And so even when we have dancers who have been active in their off season, if they have not been in class or in rehearsals, they likely have not been doing as much impact loading or jump landing. And that can be a reason why the Achilles gets kind of irritated and flares up a bit. Another reason we see a spike in Achilles issues is often related to fatigue. So again, these kind of sudden spikes in training loads often lead to dancers being more fatigued. So they're not always going to be conditioned to be able to make it through a 6-hour day or 20-hour week or whatever it is. And the more fatigued our body is, the more load there is that's going through those tendons, and they're more likely to start to feel the effects of that. We also might have potentially weaker calf muscles if dancers haven't been focusing on maintaining calf strength in the off season. Maybe, again, they just haven't really been dancing or doing similar activities. And so if they have relatively weaker calf muscles, those calf muscles are going to fatigue earlier in a class or a training day or in a week. And that is going to lead to more load just being transmitted through the Achilles in through there. And then finally, another thing to consider is whether there are technique issues that are contributing. So again, early in a dance season, when we see this increase in Achilles tendinopathy, potentially a dancer might be a little bit less proficient with their technique. So maybe they are forcing their turnout a little bit, or maybe their mechanics on their landing from jumps are not as, fine-tuned as they would be during the peak of their season. So some of these technical things might not be right at the top of their game, And so we might see more load being transmitted through the Achilles with some of these technique issues that potentially could be going on. So this, again, is another reason why in preseason, if we're following proper periodization in dance, in preseason, we want our focus to be on dance-specific strength and conditioning. And so when we think of the tendon, we're really specifically going to think of those like impact landings and really gradually increasing that over the course of, say, 6 weeks of preseason so that we don't go from 0 to 100 right away. But we also in preseason want to focus on foundational technique. And so really bringing things back to basics, make sure we're fine-tuning dancers' technique and then progressing them into harder stuff. So starting with the basics. And again, you have heard me harp on this time and time again on the podcast, but these are the reasons why. So this is just another example illustrating, in this case, from the perspective of tendon health, why having that preseason is so important. All right, we're going to shift gears slightly and talk specifically about how does Achilles tendinopathy present? Like, what are the signs and symptoms? What are dancers going to report? And then how do we manage these injuries? So there are two different types of Achilles tendinopathies that we see commonly. One that we call a mid-portion Achilles tendinopathy. So that is where the issue with the tendon is right kind of in the middle of the Achilles. So this dancers will sort of point right to the back of their ankle, right in the middle of the tendon, and sort of be like, yeah, it hurts kind of in here. And it might just be that it hurts with certain movements that they do, but oftentimes it can also be really tender on palpation. So if you're like poking at it or trying to squeeze it or something, that might be quite sore for them. The other type of Achilles tendinopathy that we see is called an insertional tendinopathy. That is just like it sounds, it's where the Achilles inserts into the back of that heel. So remember, the back of the calcaneus is where the Achilles inserts in, right at the back of the heel. And we can get a tendinopathy right at the back in through there. And so again, in these cases, dancers will generally be able to localize that fairly well. And they'll point right to the back of their heel and say, that's where it hurts when I do certain movements or certain things in class. So pain in either the mid portion or the insertion of the Achilles. And then, like I said, they will likely have pain on palpation. So if you're poking at that spot or pressing on it, that will likely produce pain for them. We will sometimes see in Achilles issues, and this tends to happen a little bit more in older folks who have Achilles tendinopathies. We don't see it as commonly in the younger people, although we absolutely certainly can. But if these get a little bit more significant, what we will sometimes see or feel is what we call like a nodule. It almost feels like a little like pea, or it's usually like kind of like pea-sized or pea-shaped, like right in the tendon. So if you're running your fingers up and down it, or sometimes you can visually see it, there'll be like a little lump or a little pea-shaped kind of protrusion from the tendon. So we can develop nodules in the tendon in kind of more progressive cases of tendinopathy. And again, this is definitely more common in an older population. So I wouldn't expect to see this as much in an adolescent population who might be dealing with tendinopathy. Most commonly, our dancers are going to report pain with relevé or any demi-point work or going on pointe, like full pointe. And then potentially on jumps, like jump landings when they have to absorb that shock through like the landing, or with plie as well. So more often than not, I would say the dancers will start by reporting pain with relevé or rise. But then again, if these progress a little bit, then they will often become sore with more of the plie and jump landing type activities. With tendinopathies in general, but again, with the Achilles tendinopathy, oftentimes dancers will report like pain and stiffness first thing in the morning when they wake up, or when they first start doing an activity. Like the first few exercises in a class feel really kind of sore and stiff, but then it kind of warms up and feels better as they keep moving. So they kind of, at the beginning of class, are like, oh, this doesn't feel great. But then it starts to feel better. And they're like, oh, actually, I can get through class and it feels like pretty okay, until they hit a bit of a wall. And then there is usually a point in time, after perhaps one class or maybe numerous classes, where then the pain levels will really start to increase again. So there's often with tendinopathies a sort of like window where once you warm things up, it feels better, but then it will start to feel worse again with increasing loading. And we're going to talk about that a little bit more when we talk about how we manage these. With Achilles tendinopathies, there are a couple of sort of differential diagnosis or other things we need to consider and need to sort of rule out in our dancer population to make sure that what we are dealing with and what we are actually treating is in fact an Achilles tendinopathy. And the number one differential diagnosis that we have to consider and that I see misdiagnosed all the time in the dance population is dancers who have a posterior impingement. And I've actually done a podcast episode all about posterior impingement before. So if you're interested in that and haven't heard that episode yet, it is episode 24. I will also link that one in the show notes as well. But it is very, very, very common for dancers to go to a non-specialized dance healthcare practitioner, so somebody who just treats maybe sports populations or the general population, and complain of pain in the back of their ankle, and especially when they go like on rise or relevé, and they will get diagnosed with an Achilles tendinopathy. But it is very common that what they are actually dealing with could potentially be a posterior impingement. So we need to make sure we know the difference in how to differentiate between an Achilles tendinopathy and a posterior impingement. And any practitioner who works a lot with dancers is going to be aware of that and is going to be able to like evaluate and diagnose for that very well. Because the treatment is different. And so if we are going to use a tendinopathy protocol for rehabilitation, we should probably be certain that what we're dealing with is, in fact, a tendinopathy. And I will say, and again, I think I talked about this in the posterior impingement podcast episode, but I get a lot of people coming into the clinic who have kind of quote unquote failed treatment for an Achilles tendinopathy with another physio where people are like, I went to see this person, they gave me these exercises to do, and it's just not getting better. And when we evaluate them, they don't actually have an Achilles tendinopathy. They have something else going on. And so it's no wonder they weren't getting better. And when I actually asked them what they've been doing, what they were doing was often really appropriate for an Achilles issue. That just wasn't what was going on. So we need to be aware of posterior impingement. And then the other thing in the population I deal with, because I work a lot with adolescent dancers, we will sometimes get people who are misdiagnosed with an Achilles tendinopathy who are actually dealing with something called Sever's disease. And Sever's disease is a growth plate irritation or inflammation. And it's the growth plate on the back of the heel, right where the Achilles attaches in. But again, this is a different pathophysiological process that's going on. This is not a tendon loading issue. This is a growth plate inflammation issue. So we just want to make sure that we know what we are dealing with. And I will say the case is usually that Achilles tendinopathies are overdiagnosed, and some of those other things like Sever's and posterior impingement are missed in diagnosis. It is not as common that somebody would miss an Achilles tendinopathy diagnosis and diagnose it as something else instead. I also do have a podcast episode all about growth plate injuries in dancers and cover some of these growth plate inflammations like Sever's disease. I cannot remember the episode number off the top of my head, but I will link that one in the show notes for you as well if you're interested in that. So once we know that we are dealing with an Achilles tendinopathy, that is truly what is happening with this dancer, what do we do to treat it? Well, the number one thing is load management. And it's really, 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 really important to sort of recognize and know that managing our load does not mean complete rest. Tendons do not do well with sudden changes in load, and that includes sudden changes in unloading a tendon. And so oftentimes dancers will maybe either kind of try and self-manage these, and they'll say, oh, this really started to hurt at the beginning of the season, and so I've just like taken the last 2 weeks off and I've just kind of like been watching and sitting out and resting. So they've like completely unloaded it. Or maybe they even went to their GP or another healthcare professional who also gave them advice to kind of unload the tendon. And we do not want to completely unload tendons. They do not do well with complete unloading. We do usually need to manage the load, and that often involves decreasing how much loading we're doing, but we don't want to unload it completely. Unloading it completely often makes it worse. And so this is a tricky one sometimes for dancers because, and actually I shouldn't even say dancers, this is a tricky one for parents sometimes, where they sort of, their gut reaction and their gut feeling is, well, my kid, if they have pain, they shouldn't be dancing. But with tendons in particular, we actually need to keep them loaded at a certain level, and then the goal is to gradually, slowly increase the loading of that tendon and allow it a chance to adapt to that loading. So, what does that look like? How do we do that? How do we manage the load? Well, we might need to look at modifying their class. So again, we're not going to unload them completely, but we're going to modify what they're doing. So that might be decreasing or even eliminating some of the heavier impact that they're doing. So that could look like taking jumps out completely. In some cases, it is not taking jumps out completely, but we might implement a jump count in class. So you can start with 32 jumps in class or 64 jumps in class and then increase gradually from there. So we're modifying their class and what they're doing and modifying their loading, but we are not unloading them completely. Modifying the load might also look like having increased breaks for them in class. So again, rather than sitting out completely, maybe they need every half an hour, they need to take a 10-minute break, or every hour they need a 5-minute break. And this is always going to depend on the severity of the issue going on, but maybe we need to look at how many breaks they're getting throughout the day as a way of modifying their overall loading. We might need to decrease how much time they're spending on relevé or demi-pointe or doing point work, and we may need to temporarily remove point work, for instance, but they might still be okay with doing some amounts or even all of their demi-pointe work. So again, this is going to depend on the severity of how they're presenting, but we are going to look at modifying their loading and modifying their class without completely unloading them. Other things that we can do to manage load is potentially we can look at things like a little heel lift. I'm very cautious with how much I use heel lifts with dancers, partly because they don't fit in a lot of dance shoes and dancers are often dancing in bare feet or socks and stuff. So sometimes it's just not practical. But also what I sometimes see is if a dancer has seen another professional, say a GP or a podiatrist or somebody else that they've seen and they've recommended a heel lift, oftentimes they've recommended too high of a heel lift. So it's too much unloading because dancers actually need a lot of length in their Achilles for, getting into pliés and landing from jumps and things like that. And so we don't want to get adaptive shortening. So I am not opposed to a heel lift to temporarily unload the tendon a little bit, but we just have to be cautious with how much of a heel lift we're using. And then also realize that the practicalities of it are that it's sometimes just not great in a dance setting. In terms of actual loading the tendon, because as much as it sounds counterproductive, the thing that tendons respond to is load and is managed load. So when we're looking at how do we build up the capacity of this tendon, we actually need to load it in a controlled way. So we might be unloading it a little bit in a class setting, but then adding controlled loading in other ways. And one of the things that we will usually start with tendon issues is adding isometric loads. And so isometric means that a muscle is contracting, but it's not changing length while it's doing it. So when we talk about different types of muscle contractions, we have concentric contractions, which is where the muscle shortens as it's contracting. So that would be like doing a bicep curl, for instance. We also have eccentric contractions, and so that's where the muscle's lengthening while it is contracting or controlling against load. So that would be like a heel lower off the edge of a step, and we'll talk about those in a second. And then we have what is known as isometrics, and this is where the muscle's contracting, but it's not changing length. And isometrics are really, really, really beneficial, especially, well, for tendons in general, but especially I find for Achilles tendons, they respond really well to isometric loading. And isometric loading is really accessible for Achilles tendons as well. So the easiest way to do it is we have a dancer stand with their toes on the edge of a step and their heels off the edge of the step. But instead of dropping the heels down into like a calf stretch position, they're just going to keep their heels level with their toes. So their foot's flat. It's parallel to the floor. And they're going to hold that position. And I'll start my dancers on 2 feet, but then you can progress to a single foot. And then we can actually load the dancers in this position too. So they could be holding a kettlebell or holding a weight of some sort or wearing a weighted vest or whatever it is. These isometric holds or isometric contractions have been shown to, well, they really help to decrease pain in tendinopathies. And there's also been some research that shows that they are actually promoting some of the kind of like cross-linked blood flow in the tendon that we want for tendon repair and tendon healing. So we will often start with isometrics for Achilles tendinopathy. Then we want to consider slow, heavy loaded exercises. So again, when we talked earlier about how muscles are different than tendons, one of the things that makes them different is how they respond to loading and exercise. And so for Achilles tendinopathy, we want to consider slow, heavy loading. And one of the exercises that we really commonly use is a calf raise, or sometimes we'll even use an eccentric calf raise. So that's where our heel would be dropping down into that sort of negative position or that heel stretch position. But we want to focus on slow and heavy movements. And when I say heavy, we're talking about loading this movement. So again, maybe the dancer is holding a weight. Maybe they're wearing a weighted vest, whatever that looks like for the dancer and what's available. We want to consider slow, heavy calf raises. Depending on the acuity of how irritated their tendon is, heavy might actually just be body weight for them to start with. So we can't necessarily always add external weight to begin with, but the goal is to eventually add weight to that. Again, usually start double leg, progress to single leg as they improve. Finally, I feel like I missed something. Nope, we're good. Okay. Finally, sorry, just looking at my notes. We want to consider like plyometric and jump training. So we talked about how the tendon is really involved in the shock absorption from landing, from jumps, and from that sort of like plie type position. And we often need to train that. And tendons have this property that we often refer to as like springiness. Like we really want our tendons to be springy because that's how they transmit load efficiently and effectively from the muscle to the bone. And so we often need to look at training this. And this sometimes looks different than just going and doing jumps in class, because jumps in class have some sort of an artistic element to them. And sometimes the accent is down on a jump and sometimes the accent might be up, but then you're immediately moving out of that position again. Like in choreography, we can't always manipulate like how it is that we're landing. So we may need to look at actually adding specific plyometric or jump training, and specifically for that springiness. If any of you guys have seen, like sometimes you'll see videos posted on online, like on YouTube or social media or things like that, of people doing little kind of like springy pogo-y type jumps where they're not jumping for height per se, but they're jumping to have like the kind of least or minimal amount of ground contact time to really train that springiness of those tendons. So if you've ever looked at some of those videos and been like, why are they doing that? And that looks really different than how we jump in dance. That is why. It has a different purpose, and it is something we need to look at training. And then as far as management goes, we could also consider, and I left this last because it's not something that I find super effective or I do a lot of, but sometimes we will consider taping, and you'll sometimes, or oftentimes I'll get clients asking about taping. There's not great ways of taping to support the Achilles. We will sometimes use a K-tape, so like an elastic stretchy tape. It is more of a proprioceptive input than anything else, but some dancers find that it helps a little bit with pain or just makes them feel a little bit more secure. So sometimes we will consider taping, but it's certainly not one of the primary things we're considering from a treatment perspective. We're really looking at load management and then progressively training and loading the tendons, starting with isometrics, then moving into slow, heavy controlled loads, and then introducing more of the kind of plyometric springiness, shock absorbing properties of the tendons. All right, so that's sort of like management when we have these Achilles tendinopathies that present in clinic. Before we finish up, I just want to talk a little bit about prevention, and I've kind of talked about this throughout the episode, but if we can prevent Achilles tendinopathies from becoming an issue before they start, dancers are going to be far, far better off, because any dancer who has ever dealt with an Achilles tendon issue knows that it can be a little bit of a slog. They are not injuries that respond like really quickly. And again, we talked about this, tendons are slow to adapt. They require more time to adapt to changes in training load. So anything we can do to prevent them from becoming an issue in the first place is actually going to be beneficial. So, number one for prevention, and I've talked about this already, please, please, please have a preseason. Also consider preseason conditioning. So looking at things like our daily calf raises. So I've talked about this before on the episode too, but there is lots of research that shows that dancers who are participating in daily single leg calf raises, there is a massive protective effect against foot and ankle injuries. And one of the things it can protect against is Achilles tendinopathies. So making sure that we are having sort of that type of conditioning implemented in our dancers' programs, and then potentially looking at implementing some of those isometric holds for the tendons, really specifically looking at increasing the tendon capacity as part of our preseason conditioning. So if you were a teacher and you were thinking about, okay, how am I structuring my classes over the first 4, 6, 8 weeks of the season, those are things that should be included for the health of your dancers' Achilles tendons. We want to really think about and look at load monitoring. So this is especially important in the preseason, but even in the middle of season, the other times of year that we see big spikes in Achilles tendinopathy problems is when there are spikes in training load, like around nutcracker performances or competition season, where all of a sudden loading and especially impact loading kind of spikes pretty suddenly. So again, we might want to implement jump counts. And this is like in your classes for all of your dancers. Be really aware of how many jumps you are asking your dancers to perform in week 1 of preseason, in week 2 of the season, in week 3 of the season, and try and have that be a slow, gradual progression. We sometimes talk about making sure that we're not increasing by more than about 20% per week. That is very, very, very hard to quantify across all aspects of dance, but it's just something to keep in mind. In an ideal world, we would also have a progressive increase in the number of hours that dancers are doing, but we know that in reality, that's often not the case. The hours are often like full hours right away as soon as you're like into the season. So we need to then think more about, okay, how are we gradually progressing the amount of impact that they're doing, or the amount of load that we're placing on these tendons. And then the other thing that we really want to be aware of and be conscious of is recognizing symptoms early and trying to address them as early as possible. Because a lot of dancers, by the time they come into the clinic with Achilles problems, they often are like, oh, it started a couple months ago, but once I warmed up, it wasn't so bad and I could kind of get through class. And then, as long as I stretched it out a lot and things like that, I kind of managed. So when you actually start to talk to dancers, these problems have been around for a lot longer. So the earlier we can recognize them, the faster they are going to recover and the more that we can do. Again, we do not want to completely unload these tendons. So if you are trying to self-manage this issue, and please get medical help, but if you're trying to self-manage this issue, do not completely unload your tendons, but we need to look at kind of managing that load. But as much as we can recognize the symptoms early, and again, like I talked about when we were talking about signs and symptoms, is these will often warm up. So they'll be stiff and sore at the beginning of class, they'll warm up throughout class, and then they'll get sore again towards the end or at a certain point in class. If that is happening, that is a bit of a red flag that the tendon is probably not super happy, and maybe you should be seeking out medical attention. A lot of dancers, because it warms up and feels better, they take that as a sign that it's not like such a serious injury and it's not really a huge problem. But that is usually a sign that it is the tendon that is unhappy. And so the sooner we can address a tendon issue, the faster they recover. So early recognition of symptoms of Achilles tendinopathy, much, much, much easier to treat them. All right. This episode has already gone a little bit longer than I like to typically keep these episodes, but a lot of information for you in terms of Achilles tendinopathies. I do plan, like I said, to cover a few other tendons, similar structure and style to this episode, sort of more in depth, just because there are a couple of tendons that we see issues with really commonly in dance. So just in conclusion or in summary, Achilles tendinopathies are very, very, very common in dancers, and especially at the start of a season. So please, at the beginning of a season, try and gradually increase your training load, kind of gradually progress it, and try not to have super sudden spikes in training, because tendons do not like sudden spikes and thrive on gradual progressive increases in load. And then, like we just mentioned, early recognition and intervention is key for having these be sort of easily treatable as opposed to an injury that maybe drags on for ages. All right, I'm going to leave things with you there. If you have any questions or want to discuss anything that was covered on today's podcast episode, please reach out to me. My email and my social media handles are in the show notes. You can reach me on Instagram at dancephysioerica with a K. Once again, thank you so much for listening. I really appreciate your support, and I hope you have a great rest of your day.